Just learn to live with it. That's what a lot of people with tinnitus hear from their doctors. What patients hear when they're told that is something very different. They hear, nothing can be done, just give up, this is your life now. And that's not accurate. And in some cases, that belief is actively keeping people from getting better. But I understand why it gets said. Tinnitus is complicated and there's no simple prescription for it. And a lot of clinicians genuinely don't know what else to offer. But the guidance to do better does exist, and too many patients are paying the price for clinicians who haven't found that yet. I'm Dr. Lane Garrett, founder of Timpanogos Hearing and Tinnitus in Utah. I have the certificate holder in tinnitus management credential from the American Board of Audiology, and I've worked with tinnitus patients for over 20 years. Today, I want to walk through the 5 myths I hear all the time in my clinic and what the research actually says about each one. Let's start with the big one, because this myth does the most damage. It's true, there's no pill you can take to make tinnitus disappear. No drug has been approved by the FDA specifically for tinnitus treatment, and that reality, the absence of a pharmaceutical cure, seemed to be where a lot of clinicians stop. They hear no cure and translate it into nothing to offer. No cure does not mean no treatment. Those are two completely different things. And what aggravates me is this isn't even a gray area. The American Academy of Otolaryngology, Head and Neck Surgery, and the American Academy of Audiology and the European Clinical Bodies for Audiology all have published guidelines specifically endorsing evidence-based treatment for tinnitus. These aren't fringe recommendations. They're the major medical professional organizations that set the standard of care for clinicians that people see. The guidance exists, which makes nothing can be done not just discouraging, it's inconsistent with their field's own governing bodies. And what do the guidelines point to? A comprehensive, multimodal approach, not one tool, but a plan built around the patient. For most people with tinnitus and hearing loss, properly fitted hearing aids are a significant piece of the plan. When the brain starts receiving adequate sound input again, the hyperactivity in the auditory system that's driving the tinnitus often calms down. The structured sound therapy goes far beyond background noise. It's calibrated therapeutic sound exposure designed to help the brain habituate to the tinnitus over time. And cognitive behavioral therapy addresses how the brain is reacting to the sound emotionally and psychologically, and it carries some of the strongest research support of any tinnitus intervention. Another option is bimodal neuromodulation. The FDA has approved a device called Linear that uses this therapy, pairing auditory and tactile stimulation, and it's producing outcomes that would have seemed impossible a decade ago. A 2025 study found that 91% of patients saw significant improvement in their tinnitus after Linear. And then there are lifestyle factors, things like sleep, stress, and cardiovascular health. Treating these things can meaningfully shift how intrusive tinnitus is to you on a daily basis. I want to be clear though, not every treatment works for every patient. Tinnitus is very complex, and what helps one person may not help another person. But a well-designed treatment plan drawing on the right combination of these tools, built around a patient's specific tinnitus situation, that's a very long way from nothing can be done. So when someone tells you nothing can be done about your tinnitus, what they really mean is, I don't know what to do about your tinnitus. Those are two completely different statements. And it probably means it's time to find somebody who does. If you're dealing with tinnitus and want evidence-based information instead of internet myths, subscribe to our channel. We do videos like this every week to help people understand what actually works and what doesn't. Now that we've established that treatment does exist, let's talk about why tinnitus is so misunderstood in the first place, because the next myth gets right at the root of that. Most people assume tinnitus is an ear problem. It's in your ears, so that must be where the issue is. That makes sense intuitively, but the research tells a much more complicated story. And here's what we see in our clinic, because it illustrates this perfectly. I had a patient, I'm going to call her Carol. She came in after being dismissed by 2 different clinicians because her hearing test looked normal. She was told the ringing was just something she'd have to manage now. And what struck me was how exhausted she was. She told me her sleep was shot, her concentration was gone, and she was starting to withdraw from social situations because the tinnitus made everything harder. That's not nothing. That's what tinnitus does when it's left unaddressed. When we ran a proper evaluation beyond the regular standard hearing test, we found exactly what the research would predict. A 2023 study from Massachusetts Eye and Ear with nearly 300 participants found that people with chronic tinnitus showed loss of auditory nerve fibers and increased activity in the brainstem. The ear wasn't working as hard, which made the brain have to work even harder, trying to turn up its own internal volume to compensate for the signals it wasn't getting from the auditory nerve in the ear anymore. This is why tinnitus can persist even when a standard hearing test looks completely normal. The damage that triggers is often what researchers call hidden hearing loss, cochlear nerve degeneration that doesn't show up on a conventional hearing test. Clinically, this matters a lot. When someone comes to me with tinnitus and a normal hearing test, that's not the end of the evaluation, it's just the beginning. We need extended high-frequency audiometry, otoacoustic emissions, psychoacoustic tests like pitch matching, loudness matching, and minimum masking levels. These are the tests that give us a much more complete picture of what's really going on. A standard hear the beep in a soft booth was never designed to catch hidden hearing loss, and it doesn't. If your tinnitus evaluation stopped at a basic hearing test, you weren't fully evaluated. Understanding that tinnitus is a brain-based condition and not just an ear problem also helps explain why the next myth is so dangerous. Because if tinnitus were simple, maybe a simple fix would work. Pull up YouTube or scroll through Instagram for 5 minutes and you'll find no shortage of tinnitus cures. Sound frequencies that supposedly retrain your brain, gummies that promise to silence the ringing, supplements with names you can't pronounce, and before and after testimonials that feel almost too good to be true. I understand why people try them. When you're exhausted from months of broken sleep and someone is confidently telling you that this $29 bottle will fix it, hope is a powerful thing. Tinnitus is isolating and desperate, making it in a way that makes people vulnerable to exactly that kind of marketing. But the research here is clear. A large international survey of tinnitus patients found that 70% of those who tried dietary supplements reported no effect on their tinnitus whatsoever, and 10% said their tinnitus got worse. The American Academy of Otolaryngology clinical guidelines for tinnitus specifically advise against dietary supplements for tinnitus. European guidelines say the same. Ginkgo biloba, arguably the most studied tinnitus supplement, has been evaluated in multiple meta-analyses. The consistent finding there is, it doesn't work. What concerns me isn't just that these products waste money, is that people spend months cycling through quick fixes, supplements, YouTube frequency videos, apps that promise habituation, while the window for getting real structured treatment is sitting wide open. Tinnitus is a condition where early, appropriate intervention does matter. Every month chasing a shortcut is a month not spent building the kind of comprehensive treatment plan that's actually going to change the outcome. If something sounds like a cure, be skeptical. The major medical and audiology organizations around the world are still working to fully understand this condition. Nobody selling a supplement online has cracked why they haven't sold it yet. So if supplements don't work and quick fixes don't work, you might think the answer is to just find some quiet, rest your auditory system, give it a break. That makes sense, but it's also wrong. And understanding why that's wrong connects directly back to what we talked about with the brain a few minutes ago. When your auditory system is deprived of sound input, the brain compensates by becoming more sensitive, more hyperactive, more attuned to internal signals. The quiet doesn't give your brain a rest, it gives your tinnitus more room. This is the same mechanism behind why tinnitus is almost always worse at 2 a.m. in a silent bedroom than it is during your busy afternoons. What actually helps is the opposite: structured sound enrichment, background noise at a comfortable level that doesn't cover up the tinnitus completely, just giving the brain something else to process. It reduces the contrast between the tinnitus and the environment. Over time, as part of a proper sound therapy protocol, it helps the brain habituate to treat the tinnitus as less threatening and less worthy of your attention. Sound avoidance feels protective. It isn't. It trains your auditory system in exactly the wrong direction. And this is something I address specifically with patients as part of our approach. The goal isn't silence. It's calibrated, consistent sound exposure that gives the brain what it needs to settle down. And that brings me to the last myth, one that quietly undermines everything else we've talked about today. Even if you've heard everything in this video and you're ready to pursue real comprehensive treatment, this myth can still derail you if you don't know what to watch for. Audiology is a broad field. An audiologist might spend their entire career just fitting hearing aids or doing pediatric hearing tests or managing balance problems. Tinnitus management is its own specialty. It requires specific training in the neuroscience of tinnitus, psychoacoustic testing, sound therapy protocols, cognitive behavioral therapy principles, and how to build a comprehensive treatment plan around an individual patient's situation. That depth of knowledge is not automatically included with our degree. The problem is that many clinics advertise tinnitus treatment without that foundation in place. A patient comes in, gets a basic hearing test, and is told, your hearing is fine, and is told, use a white noise app. That's not tinnitus management. That's a clinic not knowing what to do and not telling you that. When you're looking for tinnitus care, credentials specifically matter. The certificate holder in tinnitus management, or CHTM, from the American Board of Audiology signals that a clinician has gone through advanced, specialized training specific to tinnitus assessment and treatment. That is a very meaningful differentiator, not a marketing badge. Beyond credentials, ask what a comprehensive evaluation looks like at their clinic. Are they doing psychoacoustic tinnitus testing? Do they offer multiple treatment modalities, not just hearing aids, but structured sound therapy, CBT, bimodal neuromodulation? Are they tracking outcomes with tools like the Tinnitus Handicap Inventory or the Tinnitus Functional Index? A tinnitus clinician will have clear answers to all of those questions. Someone who just added tinnitus to their website probably won't. So let's bring it all together. Tinnitus is not untreatable. Comprehensive evidence-based care exists, and major professional medical organizations endorse that. It's not purely an ear problem, it's a brain-based condition that a basic hearing test won't fully capture. Quick fixes and supplements are not the answer, no matter how convincing those testimonials look online. Silence makes things worse, not better, and not every audiologist who claims tinnitus expertise actually has it. These myths persist because tinnitus is genuinely complex and most clinicians aren't trained on how to treat it. But if you have significant tinnitus and haven't worked with someone who specializes in it, there's a real chance you haven't seen what's actually possible. Now I'm curious, which of these myths have you believed before today? Or which one have you actually been told by a doctor? Drop your comments in below. If you want to understand tinnitus treatment more and how hearing aids, sound therapy, bimodal neuromodulation actually work and what a real evaluation should include, I've built a free online learning center that walks through the same information we cover with every patient in our clinic. You can find a link in the description below. And if you're here in northern Utah and tinnitus is significantly affecting your sleep, your concentration, or your daily life, we do comprehensive tinnitus evaluations at our clinic along the Wasatch Front. The goal is to actually understand what's driving your tinnitus and build a treatment plan around that. You can find a link to make the appointment in the description below as well. Thanks for watching.